anyone with disorders and illnesses that affect their daily life, I think it's important to figure out on those days you're well how to maintain and manage, and then rest. Your body will tell you, your body keeps score. Rest when your body tells you, and then be active when you can, and just keep it going.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by the lovely Rebecca, who is a medical cannabis patient and patient advocate. Hi, Rebecca.
Hi.
Rebecca, would you like to do a little bit of an introduction?
Of course. As you said, I'm a medical cannabis patient. You can tell by my accent that I come from the US. So I have a long history with cannabis. I was using before I had my diagnosis, and then once I actually used it in the capacity of a medicinal component, I realized that, wow, this is what all the hype is about. It's a huge deal. So I've been putting my advocacy work into motion ever since we got here to the UK, and really just trying to help progress things here as we have in the US.
That is amazing, and I know you've been doing an amazing job at it too. Can you tell me a little bit more around your experience as a patient and what sort of inspired you to, I suppose, become an advocate?
So, to be honest, I've been protesting things since year 2 of primary school. So it's just kind of in my nature to go against the grain. And as I mentioned, I've been using cannabis for a long time. I'm someone who doesn't even like taking a paracetamol. You have to really chase me down to take a paracetamol or an ibuprofen. So it was always part of my routine. And then when I had a really, big reason to use it, it became something that I relied on through my recovery journey, and that inspired me to help open up others' eyes to see, hey, this is my story, this is how it helped me, and make myself more relatable in that way. I think that it's really important to have these patient stories because it allows others to see themselves within us rather than just seeing the pharmaceutical approach.
Yeah, and from recollection, I do believe that you generally tend to. No, I think you didn't use any pharmacological intervention during your treatment. Is that correct? Yeah. Yeah. So can you tell us a little bit more around that? Because I think that's amazing. Like, I'd love to know how you're doing this.
Of course. So, in my family, my mother has a really bad scoliosis. So, and they didn't catch it quickly enough in her life to use any kind of surgical intervention. So she's been on opioids and painkillers for my entire life. So I've watched how she has had to rely on them to be able to get out of bed and do things and get about her daily life. So I really didn't want to fall down on myself and rely on opioids during my recovery process from my surgery because I knew that it's really easy to get dependent on them, especially with having such a big surgery. I had my entire left lung removed, so I didn't want to associate wellness and feeling well enough to do my daily life with opioids. So I immediately started using cannabis instead and was just really diligent with the CBD and THC tinctures that I was using to ensure that I was, incorporating that into my wellness and recovery journey, along with challenging myself to work out and eat right and doing all those things because I know that for her, it's been such a struggle, and I know she wouldn't want that for me.
And that is amazing. And I think you hit on a very key component there, which is doing all of the other stuff as well. I think a lot of the times when it comes to medicine, people generally just tend to take the medication, and that is the be all and end all for them. And they often forget that the medication is a symptom reliever. It enables you, it should enable you to have some relief of symptoms so that you can go and do all of the other relevant things that you need to do in order to promote a healthier body, healthier mind, even healthier attitude. So it's amazing that you use this holistic approach to your care. I mean, from your opinion, what are some of the things that you feel patients, I suppose, in America and in the UK, would benefit from when using medical cannabis?
Not getting too in their head about being a patient. I think sometimes that term kind of consumes us and becomes the be all end all. I watch it in my cancer community too. I see uh, some people on the community boards talking and looking for this silver bullet to make everything go away. And there is no silver bullet. There is no magic that's going to solve us. There's no panacea. So I think understanding that these ingredients are part of our wellness journey, but not just allowing that to consume our identity. I don't live my life as a cancer survivor or a medical cannabis patient. I'm just Rebecca, and I do the best I can to be the best Rebecca I can every day, and understand that each day I wake up is a gift and live it to my fullest. So I think the first piece of advice I would give is try not to categorize yourself because that's puts a lot of pressure on you. So do your best every day, and on the days that you fall down, get back up the next day and try again. It's a lifestyle change. Incorporate things that you know will be beneficial. Treat yourself like a house plant. Get sunlight, water, nutrients. Like those are the basics. I see a lot of people who are reliant on medicine but not looking after their diet or worrying about their stress levels or looking at sleep or trying to get outside and move their body. So I think that the accountability, intention, are all really important aspects to take into consideration.
That is, those words are just music to my ears. Thank you so much, Rebecca. No, no, I mean it because I agree. I feel like a lot of the times, medical cannabis, I often say this, is too effective, yeah? Because generally, when somebody gets to a point in which they start exploring medical cannabis, they've reached a point in their lives where I say their ailment or disability has completely taken control of their life, and they're just trying to regain that control. And then they discover medical cannabis, and all of a sudden they're getting out of bed, they can do things again, they're just excited about life again and about I suppose having fewer limitations. And as a result, they sort of think, oh well, I found my sort of like magic wand, this is it. When in reality, no, that's not it. That is just a part of it. That is something that has put you in a place now where you can incorporate all of these relevant lifestyle changes. And I know it's hard, like it's very, very hard to have to maintain that, but it's only really difficult at the start. Once you maintain that, it becomes part of your lifestyle and it's second nature to you. Like, I mean, for myself, I know when I go to the doctors and they're like, okay, you know what, Berta, you need to take it a little bit easy on the exercising. And I'm like, what do you mean I need to take it easy on the exercising? And my body feels it. Like, it's sort of like I feel so agitated. I'm like, oh, I haven't worked out in 3 days. I feel so, before it was such a struggle to get out of bed and get onto the floor, and at the start I couldn't even do anything. It was just like wiggle your toe or wiggle your leg or just wiggle your arm, just wiggle something until you get to a point where you're finally able to do things. And what that's done for me is I've been able to reduce down on my medication and not rely on it as much. I mean, I am still very disabled, so I still need it, but I don't need as much as I used to because my health is improving along the way. And I suppose that is a message that I just really want to get across to existing patients and to any patients that want to consider medical cannabis, to look at it as medication, as part of your treatment, and not as this lifesaver. And because I know in a way it is, but it's just okay. I'm rambling now, but
No, I love it. I'm same. It's where you're swapping one thing. If you're you want to get off the daily prescription and then you go over to cannabis, it's another daily prescription. It's kind of like I think you and I are big into challenging our bodies though. Like let's see how much we can do. Like um for me, like I last year I went and to go see if I could go to the top of Mount Pilatus in Switzerland, which is I think 7,000 feet. A little, I don't know what in meters, but I wanted to go up and see if I could breathe up there. I was like, because I was like, how is one lung gonna do at the top of this mountain? So I like to push myself and see where those limits are, and I feel like it's really easy to get comfortable, but your comfort zone will kill you. So, especially as anyone with disorders and illnesses that affect their daily life, I think it's important to figure out on those days you're well how to maintain and manage, and then rest. Your body will tell you, your body keeps score. Rest when your body tells you, and then be active when you can, and just keep it going.
Yes. And I think you've hit the nail right in the head. Go with your body. Don't feel guilty if you cannot do something that day. I know myself. I know I need to practice what I preach.
I'd be given the same advice, and I was like like we both have been in bed recently, texting each other, being like, "We've got this, we've got this."
Okay, do as I say, not as I do.
It's an affirmation. We're affirming it, right? Because I do the same thing. Yeah.
We're working on it, but just, yeah, don't feel guilty. I know myself. Generally I like to be very active, and I've got ADHD. It kills me to sit in one place. So when I am bedbound and I find it really, really difficult to get out of bed that day, I get really frustrated because I'm like, oh, I haven't done anything today. And it took me a really long time to learn how to just stay there and do nothing and just watch TV or just distract your mind, but just do nothing. And what I've noticed is when I do that, I now have a quicker recovery time. So rather than being bedbound for 4 days, I'm bedbound for 2 days. So I know, and somehow we still, kick ourselves when we have those days, even though we know that we need those days in order to sort of like get back on track, if that makes any sense.
Well, as a mom, is there ever a day off? Like, so, like, I feel like we just take off one hat and wear the other, and we don't really like give ourselves the hat to like rest, Because, I mean, yesterday I was doing meetings in bed with a hot pad behind me, and so I feel it. I'll sit there and crank it up. I'll have the hot pad on my back, and it's just we do the best we can, right? Just having grace with yourself, the same grace we would give to other people, we need to give to ourselves.
No, 100%. Like I said, I totally admire you for that because you're a mother. You are living with a chronic illness. You are advocating for medical cannabis and advocating for women within the medical cannabis society as well. Would you like to actually touch on that a bit because that's some fabulous work you guys are doing there?
Yeah, so in I want to say it was September now, I was at a conference in Germany, and we were just wrapping up a women's in cannabis panel. And so we started this little group chat because we've noticed there's about 10% of the attendees at these shows are women. So we started a group chat to locate all 12 of us, And that group chat blew up to, I think now it's 500 women. It's now called the EmpowHer Cannabis Society. And there are women from over 22 countries on this channel, and it's just really incredible. So I'm really happy to have been the founder of it, but I'm actually have taken a step back to focus on my health and my family, and a move that I'm making to Portugal pretty soon. So I'm really excited to see it take the next step, because if within less than 6 months it grew to 500 members just organically, I can't imagine what it's going to do in the next 6 months. So it's a really great space. I think that there's a lot of opportunity for women to really collaborate and lift each other up if they want to, as long as we're all willing to put competition aside and see each other as sisters in this and collaborate.
Yeah, and that's absolutely fantastic. As a member, I personally feel that it's very empowering, supportive, and like you mentioned, there is no competition there. It is just women supporting one another. And that is it, and which is amazing. And all the women are so passionate about medical cannabis and work in a variety of different sectors within the medical cannabis industry. Yeah, and you're learning. No, exactly, exactly. And I'm learning so much, I'm learning so much about a variety of different areas because my predominant area is all about healthcare and patients and, running clinics and services rather than the cultivation side of things, which I had very little knowledge about. Whereas now I can tell you a lot of different things. And that's really down to the Chico system.
Yeah, it's great. It's one of the things that I noticed when I moved from the US to the UK and started traveling around Europe and attending different trade shows. Is that was the one of the few components, that and really the talking about extraction and the science behind the refinement and what's actually being put into the medicine. But then the lack of female representation, which the cool thing is I've watched a lot of different event producers contact and want to get involved and support us and say, great, how can we elevate, empower her? How can we get you all involved? So that's been phenomenal to see, so there's a lot of community support out there, and I can't wait to see what happens and how it evolves.
Yeah, no, that is absolutely amazing. And on that note, before we wrap things up, would you like to, I don't know, put forward some suggestions for the future? Sorry, my slurred speech is happening over here. Yeah, sorry guys, fiber fog. Would you like to put forward some suggestions for I guess, the medical cannabis community in the UK moving forward?
Yes. So I would say we need to focus on grassroots campaigns. I feel like there's a lot of noise about how people don't know that medical cannabis is available. So we know that there's at least 32,000 patients. If all 32,000 patients went back to their doctor and spoke to their doctors and said, hey, you haven't seen me in a long time because this is working really well. That's why you haven't seen me. And also talk to everyone. Like I talk to my decorator, my gardener, like grocery clerk, like everyone I can talk to about it knows. I wear shirts to the gym that mention cannabis. It's on my water bottle. Like it's everywhere. I'm a walking billboard. Like I said, I've been an activist since like second grade. So like for me, it's always like it's either orca whales or cannabis. That's kind of the topics I bring up. So talk to everyone. If there's a lack of awareness, then make them aware. And the other thing is we need to speak on how the obstacles for getting a prescription. It's challenging to show two tried treatments. I think that that's where a lot of people struggle. So just talking and having open conversations with your GP before you go to the cannabis clinic, talk to the cannabis clinics about it, find out, ask questions, and then if you don't find that you're getting the right answers from the first cannabis clinic you speak to, go to another. I mean, as someone I've had cancer and have a novel of health issues and had my oncologist, my GP here, my GP in the US, my oncologist in the US all recommend me for medical cannabis, all for the same reason. And I still got denied by two clinics. So, I had to fight to get a prescription. So I can only imagine what that would look like for people who don't have the health history that I have. So don't take no for an answer. This is the one instance when I would say that.
Yeah, no, I completely understand you, and I'm sorry you had to go through that experience. One of the things that I can reassure yourself and future patients is that the restrictions have laxed a little bit since I think it was September, yeah, in September. meaning that you only have to basically be able to identify an unmet clinical need. They are doing out with the two prior treatments thing because they realized that that was too much of a barrier for some patients, particularly patients who would prefer a more holistic sort of approach rather than just pharmacological interventions at the GP. I think, yeah, that is sadly an issue, which I fully agree with, that there have been an arm and a leg full of patients that have unfortunately struggled to get their medicine. And I believe one of the ongoing concerns is getting their prescription as well at pharmacies. That is a huge barrier because once they do get over the first hoop, there's still that other hoop to go through with the pharmacies, which I've recently learned has turned people back to illicit purchasing rather than actually legitimizing their prescription, I suppose, which is very sad.
Yeah. And so, for any producers out there that might listen to this, what I think is really important is that taking some of that pressure off the patients, because there's many producers that are creating press releases and patting themselves on the back for entering the UK and Germany and all these other markets, right? Now, with 32,000 patients, and I want to say, 89 cultivars and all these other products on the market, it's already a really competitive market. So the only way more patients are going to see your product, regardless of having the most beautiful GMP facility or the best packaging, it's going to be increasing patient numbers. So putting more money towards lobbying and things like that that really help move the patient number up, because unless we see an increase in patient numbers, we're not going to see an increase in product being purchased from the medical side. We're going to see the illicit market continue to grow. And I think that that's something that is really important, is also putting some pressure on the producers and ancillary businesses that are trying to make a buck in this market, understanding that it is their responsibility to help grow this market then.
Yeah, I didn't even think of it in that context either. It's, I mean, moving forward in the industry, I think there is a lot of amazing work that has been done, and there's a lot of amazing work that can still be done. I think we're still at that point where we ourselves also need to sort of fine tune some of the governance that we have around prescribing here in the UK, if we want to bring more people in and it not be a messy situation, if that makes any sense.
Yeah, I mean, it's economics, supply and demand, like.
Oh no, but that's amazing. But so Rebecca, thank you so much for joining us here today. And I'm glad that you are taking time off to take care of yourself and listen to your own advice. Practice what you preach. No, no, I am actually practicing what I preach, so I'm proud of myself as well. But thank you so much for joining us here today and for sharing your incredible story and the amazing work that you have done lobbying for medical cannabis as a viable treatment option in the UK. Um, as I've always said, your work has been absolutely phenomenal here in the UK, and we are so happy to have you on here today. For anybody who is interested in more of the work that Rebecca does, in the description will be all of her links. And thank you everyone for joining us today, and we look forward to seeing you next week where we explore medical cannabis and rehabilitation. Thanks.
You too. Thank you.